Welcome back to Health Bulletin. Get ready for another episode filled with the latest updates in global medical news. Let's start with our first story, all the way from China, where a mysterious pneumonia outbreak has been reported. In the early morning, in Beijing and Liaoning, hospitals are grappling with a surge of ill children, impacting both students and teachers. Children's hospitals in Beijing, Liaoning and other places were overwhelmed with sick children. Many schools and classes were on the verge of suspension. Parents questioned whether the authorities were covering up the epidemic. Concerns are being raised about an undiagnosed pneumonia epidemic spreads throughout Beijing and other Chinese cities. A resident of Beijing remarked, "Many people are being hospitalized with a high-grade fever, and many end up developing pulmonary nodules." The situation in Liaoning province is also serious. The lobby of Dalian Children's Hospital is full of sick children receiving intravenous drips. There are also queues of patients at the traditional Chinese medicine hospitals and the central hospitals. Some school classes have even been cancelled completely. Not only are all students sick, but teachers are also infected with pneumonia. Since China stopped adhering to the zero policy at the beginning of the year, 2023, epidemics such as influenza, mycoplasma, and bronchopneumonia have broken out from time to time. This report suggests a widespread outbreak of an undiagnosed respiratory illness in several areas in China as Beijing and Liaoning are almost 800 kilometers apart. It is not at all clear when this outbreak started, as it would be unusual for so many children to be affected so quickly. As reported by ProMed, further information is awaited to provide a more definitive understanding of the cause and extent of this worrisome illness in China. At present, it is too early to predict whether this could evolve into another pandemic. However, according to an influenza virologist, the pandemic clock is ticking. We just do not know what time it is. Number 2. Shows U.S. men die 6 years before women, as life expectancy gap widens. We've known for more than a century that women outlive men. But new research led by San Francisco and Harvard Public Health shows that, at least in the United States, the gap has been widening for more than a decade. The trend is being driven by the COVID-19 pandemic and the opioid overdose epidemic, among other factors. Life expectancy in the U.S. dropped in 2021 to 76.1 years, falling from 78.8 years in 2019 and 77 years in 2020. Researchers suggest that there is a need to consider specialized care, especially in mental health, for men to address the increasing gap in life expectancy. Number 3. How to improve heart health. Any activity is better for your heart than sitting, even sleeping. The recently published study, supported by the British Heart Foundation and featured in the European Heart Journal, show how different movement patterns throughout the 24-hour day are linked to heart health. It is the first evidence to emerge from the International Prospective Physical Activity, Sitting and Sleep, PROPAS, Consortium. Cardiovascular disease, which refers to all diseases of the heart and circulation, is the #1 cause of mortality globally. In 2021, it was responsible for 1 in 3 deaths, 20.5 meters. With coronary heart disease alone the single biggest killer. Since 1997, the number of people living with cardiovascular disease across the world has doubled and is projected to rise further. We already know that exercise can have real benefits for your cardiovascular health, and this encouraging research shows that small adjustments to your daily routine lower your chances of having a heart attack or stroke. Getting active isn't always easy, and it's important to make changes that you can stick to in the long term, and that you enjoy. Anything that gets your heart rate up can help. Incorporating activity snacks, such as walking while taking phone calls, or setting an alarm to get up and do some star jumps every hour is a great way to start building activity into your day, to get you in the habit of living a healthy, active lifestyle. Let's move on to our 4th story. Did you know that bacteria store memories and pass them on for generations? Scientists have discovered that bacteria can create something like memories about when to form strategies that can cause dangerous infections in people, such as resistance to antibiotics and bacterial swarms when millions of bacteria come together on a single surface. The discovery can help in the prevention and treatment of bacterial infections and provide a solution for antibiotic-resistant bacteria. Researchers at the University of Texas at Austin found that E. coli bacteria use iron levels as a way to store information about different behaviors that can then be activated in response to certain stimuli. The UT-led research team set out to learn why. Bacteria don't have neurons, synapses or nervous systems, so any memories are not like the ones of blowing out candles at a childhood birthday party. They are more like information stored on a computer. But they can gather information from their environment, and if they have encountered that environment frequently. As stated by a researcher in molecular biosciences at UT, they have the ability to retain that information and subsequently access it later for their benefit. It all comes back to iron, one of the most abundant elements on Earth. Singular and free-floating bacteria have varying levels of iron. Scientists observed that bacterial cells with lower levels of iron were better swarmers. In contrast, bacteria that formed biofilms, dense, sticky mats of bacteria on solid surfaces, had high levels of iron in their cells. Bacteria with antibiotic tolerance also had balanced levels of iron. These iron memories persist for at least 4 generations and disappear by the 7th generation. Iron is not only critical in the origin of life on Earth, but also in the evolution of life. Researchers theorize that when iron levels are low, bacterial memories are triggered to form a fast-moving migratory swarm to seek out iron in the environment. When iron levels are high, memories indicate this environment is a good place to stick around and form a biofilm. Iron levels are definitely a target for therapeutics because iron is an important factor in virulence. Ultimately, the more we know about bacterial behavior, the easier it is to combat them. Number 5. New approaches in the fight against drug resistance in malaria. FAO research team develops drugs for the treatment of malaria. Malaria is one of the most widespread and deadly infectious diseases worldwide. New compounds are continuously required due to the risk of malaria parasites becoming resistant to the medicines currently used. A team of researchers has now combined the anti-malaria drug artemisinin with coumarin and developed an autofluorescent compound from both bioactive substances. This autofluorescence is particularly advantageous as it can be used for imaging in live cells and shows how the medication works in a precise time sequence. The working group also discovered that the autofluorescent artemisinin-coumarin hybrids are able to destroy a certain drug-resistant malaria pathogen called Plasmodium falciparum. They have published their findings in the journal Chemical Science. Number 6. An intriguing study on nostalgia and memories, reflecting on a decade of social media. As possibilities have changed and technology has advanced, memories and nostalgia are now a significant part of our use of social media. Researchers at the University of Gothenburg and University West have been following a group of 11 active social media users for 10 years, allowing them to describe and reflect on how they use the platforms to document and share their lives. The study provides insight into the role of technology in creating experiences and reliving meaningful moments. These types of studies help us look back and understand the culture as it was in the 2010s and 2020s when social media was a central part of it. Social media users engage in what researchers define as social media nostalgizing, meaning they actively seek out content that evokes feelings of nostalgia. Going back and remembering what has happened earlier in life becomes a bigger part of it over time than posting new content, she says, and explains that in later interviews, it becomes clear that the platforms often serve as diary-like tools that allow memories to be relived. Personal, music-infused photo albums generated for us are reminders of pictures we posted on the same date 1, 3, or 10 years ago allow for nostalgic experiences, which are often seen as positive. Number 7. A promising new treatment strategy for diseases like glaucoma by stem cell therapy. Glaucoma is one of the leading causes of blindness worldwide, and vision loss, due to the loss of retinal ganglion cells, RGCs, cannot currently be reversed with any treatment. Some studies have looked at replacing RGCs through stem cell transplants. But this process is still in the research and development stage. Now, a multidisciplinary team led by researchers at the Schepens Eye Research Institute has identified a promising new strategy for glaucoma cell replacement therapy. Researchers believe that techniques that potentially be applied to treat other neurodegenerative conditions.
Thanks for watching.